Here we can see this is the region of the oral cavity. Behind the nasal cavity, we have the nasopharynx. Behind the oral cavity, we have the oropharynx. Below the level of the epiglottis, we have the pharynx. Anteriorly, you can see this is the voice box or the larynx. Now coming to the roof of the nasal cavity, here you can see this is the frontal bone, and within the frontal bone you can find a hollow space, that is the frontal air sinus. Behind, as you move, you can find this is the sphenoid bone, and also within the sphenoid we have a large empty space, that is the sphenoid air sinus. Now moving to the nasal cavity, here we can see this is the superior concha, this is the middle concha, and finally here you can see the inferior concha. This concha are the bony projections from the lateral wall of the nose, which greatly increase the surface area and produce the turbulence in the inspiration phase of respiration. Now this nasal cavity, as you can see, is separated from the oral cavity by this structure known as the palate. The anterior part we have the bony hard palate, and posteriorly we have the muscular soft palate. Now this bony hard palate, it is formed by the palatine process of the maxilla and the horizontal plate of the palatine bone. Posteriorly you have the muscular part which is forming the soft palate. Here you can see the musculus uvulae or the uvula. In the oral cavity, you can identify anteriorly this is the cross section of the mandible. Posteriorly, there is the presence of the genial tubercles. These genial tubercles, from here arise the fan-shaped muscle known as the genioglossus. This is known as the safety muscle of the tongue, as it prevents the backward falling of the tongue when a person is unconscious. Now, if you look at this oral cavity, behind you can see this arch coming from the palate to the tongue. So this is the palatoglossal arch through which the fibers of the palatoglossus move. So we saw two extrinsic muscles of the tongue, that is the genioglossus, the palatoglossus.